Hello, lovely. I understand you've been experiencing some issues with your jaw. Would you be able to elaborate for me, please? Okay, so you've been having a lot of pain in your jaw, which is giving you headaches. Okay, any other symptoms? Clicking, clunking, and you're struggling to open your mouth very wide. Okay. Okay. Has it locked in place at all? Okay, that's good. So when did this start, my love? And it's gradually just getting worse and worse. Okay. All right. So, have you ever had any troubles with your jaw in the past, or is this the first time? Okay. Any history of jaw issues in your family? Okay. All right. Okay, so I'm going to start by having a look, if that's okay. So if you wouldn't mind just stay nice and still for me, okay? Have you noticed any swelling? Okay, you definitely do have some swelling there. I can see that here. Okay. Okay, could you just say something for me? Just say any sentence. Okay, good job. Okay, now slowly and carefully, if you could open your mouth as wide as you can for me, okay? Nice and steady. And you can't go any further than that. Okay, we can relax. Okay, now if you could just open your mouth and just rest your jaw slightly so you've got a bit of a gap. Okay, now could you rock it side to side? Okay, stop. Close your mouth and can you rock it? Okay. When you were doing those actions, did you have any pain? Now, with your mouth closed, if you could move your jaw to that side and just hold it, that's it. Okay, relax. Now, can you do that side? Good job. Relax. Do you feel like one side's worse than the other? Okay. Right, if I could get you to just open your mouth. Okay, and relax. So I'm going to go open, close, open, close. Good. Now open your mouth as wide as you can and hold it for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. I could see that. It was getting quite difficult, wasn't it? Okay. Now open your mouth, but open it comfortably. Okay, and hold it for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. How's that? Easier, but it was quite uncomfortable. All right. Okay. Now, would you mind just puffing out your cheeks for me? Any pain or discomfort? Could you make a chewing action? Can you open your mouth a little bit and do the same again? Okay, relax. I can definitely see that. It's like a bit like a seesaw, and I can sort of hear a little bit of clicking. Now, tell me, is it louder when you're eating harder food? So, for example, like toffee, hot sweets, etc. Okay. Any time of day that it's worse. Okay. Now, what about the pain? Do you find that it's worse as the day goes on? Yeah. Okay. And what about if you're talking a lot? Do you find that you're getting a little bit uncomfortable, a little bit of pain? Okay. Okay, what I would like you to do is count to 10 for me. Okay, now can you say all the days of the week for me? Thank you. How did you find that talking? Okay, now what I want you to do is just move your mouth, jaw in all sorts of different positions for me. Okay. That's it, all sorts of different positions that you can. Okay, good job. Definitely could see discomfort there, and I can hear a little bit of noise as well. Did you find it quite difficult, quite painful? Yeah. Okay. Now, when you're moving your jaw around, are you getting any pain elsewhere? Like, does it hurt your temples? Okay. All right. Okay. Now, my love, tell me, what's your sleep like? Okay. So, when you wake up in the morning, are we in pain? Okay. Here and here, and usually have a headache and neck pain. Okay. Now, have you ever been told you grind your teeth or you clench? Not that you're aware of, okay. When did you last go to your dentist? Okay, that was a while ago. I'd recommend that you book an appointment. I will have a look at your teeth in a moment, but I'm not a dentist, so I can't look at your teeth and diagnose anything, but I can see if we've got any, you know, grinding or anything going on. Okay, wonderful. Yeah, okay. So how is this affecting you day to day, my lovely? Yeah. Yeah, feeling pain, not pleasant. Yeah, uncomfortable, fed up with talking, and I understand that. It's giving you, yeah. So it sounds like it's really affecting you. So we need to get this sorted for you, don't we? Yeah, okay. Okay, now would you mind just show me your teeth? Okay, now clench them together like that. Okay, now could you bite on your teeth? Okay, so just bite down on the back teeth. Okay, relax. How was that? Was it uncomfortable? Okay, show me your teeth. Okay, and clench down like that. Okay, thank you. I will be feeling around shortly and getting you to do different things again, my lovely, but I like to just observe and get you to do things first. So the alignment does appear to be off slightly. Okay. Right. Now, is there anything else you would like to tell me about this issue? Any symptoms or things that you're unsure of? You know, it may be or may not be connected, but are you worried or concerned about anything? Yeah, okay, so when you say face pain, are we talking here or are we on about somewhere else? Okay, whereabouts? Yeah. Okay, my lovely. Yeah, it's all sounding like it's connected. Yeah, it's definitely going to be causing you headaches, potentially migraines, definitely, you know, neck pain, cervical spine, potentially around the shoulders, and obviously you're straining with the pain and things like that. It could be putting pressure on other areas, and definitely you could be, you know, feeling pain in your sinuses and things like that. So yeah, that is quite common. Okay, so what I'm going to do, my lovely, is pop on some gloves and I'm going to carry out some different checks and have a feel around and see what's going on. All right, okay. Do you wear braces, retainers or anything like that? Okay, and do you wear any mouth guards? And with your teeth, do you have any fillings or anything like that? Okay. Any piercings in your mouth? Okay. Right, am I okay if I touch your face? Good. So let's have a feel. Oh yes, that is swollen. Now when I'm pressing, does that feel uncomfortable? Okay, so it's actually quite nice. Okay, so it's quite relieving. Okay. it's definitely swollen there. Just go up by your ear a little bit. Bit of discomfort there, okay. Okay. Same. Okay. I'm just going to feel your glands. Any pain or discomfort? There's no swelling on your glands, it's fine. Just bring it down the neck a little bit. That's fine. Okay, I'm just going to feel your ear, okay? Just let me know if you do feel any pain or discomfort. Okay, there's definitely some discomfort here, a bit of tension, but you know, you weren't feeling a lot of pain, so that was good, but I could definitely tell there's something going on there. Alright, so just going to feel the sinuses. And just around your face a little bit. Just tell me where it hurts, okay? If any at all. Now, do you normally get headaches? So only since this issue, okay. So just sitting there, do you have any pain? Okay, no. So what about when I press? A little bit of discomfort, okay. Can you open your mouth for me? Okay, close, open, close, open, close. Okay, make a chewing action. Can you open your mouth a little bit? Make a chewing action. Okay, now can you move your jaw side to side? Okay, and open and do it. Okay, relax. Okay, show me your teeth. Okay, now clench down. Okay, relax. Right, so let's get my light. Where are you? There we go. Right, if you could open your mouth for me, my love. Okay, now I want you to just kind of rest your tongue. That's how it's comfortable for you, okay? Okay, now can you open as wide as you can? Okay, now open so it's comfortable. Okay, I'll try and open a bit wider for me now. So, your teeth are showing signs of grinding or clenching. Yeah. Okay, relax. Yeah, you can see because they're slightly worn and how they look. All right. You may not notice it. Other people you're with may not notice it as well, especially if it's more of a clenching. It's, not necessarily noticeable. Do you experience any nightmares or anything like that? Okay, interesting. Yeah. Okay. So if we have nightmares, typically say people with PTSD, complex PTSD or things like that, during nightmares we often clench, and it's like our body's full of tension, and obviously we're scared, and it's bringing back trauma, and our body can tense up, and that's what happens is your teeth are being pushed against each other, and that's why you're waking up with severe pain, struggling to open after you've slept, and in turn that is wearing down your teeth. All right, so really do need to go and see a dentist and get them to do your mouth guard for nighttime. That can help with wearing your teeth down, and it can also help level your teeth out slightly as well, and in turn help relieve pain. I think I know what's going on, but I just want to do a few more things if that's okay. Okay. So this has got some special stuff on it. I want you to pop it in your mouth like so and bite down. A bit harder. Thank you. Yeah, we definitely have an alignment issue. Yeah. Okay. So your alignment's not quite right, which is not going to be helping. Now, have you had any car accidents or head injuries, anything recently? Okay. So no whiplash or anything like that. Okay. Okay. So you definitely have some temple pressure here, masseter muscle, a lot of that problem. Okay. Right. So have you heard of TMD, TMJ? Okay. So TMJ is the joint, okay, and TMD is the disorder. Okay. That's what's going on with you. All right. Okay. So there's definitely a bite alignment issue, as I said, which is not helping and could be causing that. The clenching, the nightmares, the grinding of the teeth, that is causing it too. All right. So obviously that puts a lot of pressure on when you are asleep. So if you can try and get your nightmares under control, that's going to help relieve the tension and the stress on your jaw. All right. Okay. And then the more stressed you are, the more tension and build-up you're going to have in your face muscles, as I said earlier. All right, so we need to try and de-stress a little bit if we can. All right, and obviously because your bite is slightly off, that's causing problems straight away. Okay, but could be clearly a joint issue and maybe something like arthritis that's causing this TMD. All right, yeah, so it could be something simple just because you're a bite and obviously your nightmares, but it could be from arthritis and I won't know that without a scan. Okay, so I just want to check your posture. All right, look. All right, sit as you would, just relax. Okay, I'll sit nice and tall. Okay, now are you on the computer a lot? Are you feeling a lot? Are you looking down? Okay, so bad posture can obviously cause trouble with your jaw as well. I don't think in this instance that is what's causing your TMD. All right, so you've had no injury or anything like that or issue to the jaw or neck, so it's not that that's caused it. All right, so what I think we need to do, there's a few options. I'm going to give you a little bit of a massage before you go, just on your masseter muscles, okay, just to relieve a little bit of tension there for you. Now, dentist. Go to the dentist, get them to have a look, get them to issue you a guard for bedtime. That's going to improve massively and obviously help protect your teeth. So that's the first thing I need you to do. All right, okay. Try to reduce your stress a little bit if you're having trouble sleeping. Maybe try some ASMR or relaxation music, meditation, and maybe look at seeking out some therapy or something like that for the nightmares, for your complex PTSD. All right, that will be a real help to you. All right, and in turn that will help and reduce the stress and the tension there. Then need to try and help, obviously, with this. Now, pain relief is going to be great, but I don't want you to get dependent on it. Regular face massages would be fantastic for you, and maybe even a scalp massage included in that. That would be fab. Something like that would be really good. You know, we need to look at your bite alignment a bit more. The dentist will be able to help you with that, and you know, maybe refer you to a specialist to get that sorted. Maybe if they need to remove a teeth or, you know, put on a brace or something like that, they can have a look at that and do that for you. All right, I will write all this up in a report and give it to you so you can take it to your dentist as well. All right, okay, so I'll do that for you. Want to get you a scan, all right, and get that on your face. I want to look at your, obviously, your jaw. So I need to get that sorted for you for the next week or two, and then you can come back and get your results and we can go from there. But I'm thinking of treatment now as well, so I'm thinking of possibly giving you some Botox here. Now, yes, it can have a slimming effect on the jaw, but in this instance I want to use it to help relieve the tension. Yeah, it's fantastic for migraines and actually for jaw issues. So we can inject certain areas in your temples and your forehead to help with migraines, and if we can inject this masseter muscle here, it would also help relieve tension. You know, your muscle's not going to be as tight, it's going to be more relaxed. So I think that's something we could be looking at for you. I do think so, yeah. I mean, I would suggest you go away and have a Google and look into TMD, TMJ, look at teeth clenching / you know, grinding teeth due to nightmares, and look at Botox for migraines and the masseter muscle. Have a look into it and you'll see what I mean. All right, so I need you to avoid clenching as much as possible. Try to relax your jaw as best as you can and just try to take it easy. I think there's a mix of things going on here and we need to kind of get it all sorted, nipped in the bud a little bit. Yeah, I think we need to get you to relax is a big factor. Get you to relax, get you a night guard, get you some Botox in, regular massage, get you some therapy, and, you know, go from there. I think so. Yeah. All right. So hopefully there's no arthritis. If you clench and grind a lot, in turn that could cause arthritis, and then you're going to get long, like standing pain, and all sorts of things like that. And we don't want to get it that far, really. Yeah, but you know, I do want to do the scan first to rule that out, because if that is already there, I could offer other treatments and things. All right, my lovely. All right, I know that's a lot to take in, but you know, you're here. We can get this sorted for you and under control. All right. Do you have any questions? Yeah, I've said a lot, haven't I? So what I will do is write everything up for you. I will get it all sent over, and you can have a look at everything, and if you do have any questions, then you can come back to me. Then you'll get a scan appointment come to you. Go and have your scan. Then we'll have a chat, whether it's over the phone, on appointment, go through the treatment process then. And if you do want to come back and get some treatments or some Botox and things, that'd be really good for you. So yeah, let's do a mini bit of a massage now. All right, so I'm just going to get a little bit of this special oil. I don't want that one or the other one. There we go, this is the one. Yeah, just any, you know, face massage really, scalp massage, somewhere, salons, you know, they might be able to do you a massage, or having a facial, and then they do a little bit of that in as well. Yeah, if you tell them you've got TMD, TMJ, depends what, you know, people call it different things. And then they'll be able to help you. But that night guard is, you know, it's going to be great. Nice. I mean, you could do a little bit of massage yourself, or somebody you know. Okay. Do you find a lot, like if you're just like resting, your jaw still feels quite tense? Yeah, we need to try and relax that as much as possible. Yeah, I think so. All right. Now, if you do that quite regular, that's going to help you a little bit. All right. Yeah, I could definitely do that for you, my lovely. I can definitely do the Botox for here and your migraines. Yeah, I mean, I'd have to get you to come back though. Would that be all right? You sure? Okay. Wonderful. Okay, so let me have a look. So I need you to have the scan first, really. just see if I can get any scan appointments. We'll just take these off. Alright, let's have a look. It doesn't always allow me to get on the system for the scans, you see. Okay. Oh, there's a cancellation, like in the next hour. Yeah, would you like me to book that now? Okay. How lucky was that? Okay, I'll pop that in. And just read me your number. Okay, right, that's all booked. You should get your text with that. Wonderful. So that is in an hour. You'll have your full scan on your jaw area and we can see what's going on. All right, so that'll be really good. Then we'll have to wait probably 4 days or so to get the results. So then if you would like me to book an appointment, I could speak to you over the phone. Yeah, should we do that? So we're a week. Okay, so in a week, let's see what I have. Anytime that suits you. Oh, let me have a look. How's 9:30? Yeah, is that all right? Okay. Good, I've got you in. Right, you should get a text. Right, so let's recap. Scan in an hour, all right, to get all that done. I'll get the results within 4 to 5 days. I'm going to speak to you on the phone in a week and we'll discuss the scan results. And then you want to come to me and have some Botox done. So would you like me to book that now or wait until I speak to you on the phone? I can book it now. Okay. So, how's 2 weeks? I could do the same day and time. Yeah. Wonderful. That's all booked in. You should get a text now. So, Botox, I will email you with all the information that you need to know, but avoid any caffeine. As a big must beforehand. We don't want any bruising and things like that, okay? But I will send you all that over in the email. You'll get an email with all your appointments and all the information that you need, okay? That will be all sent to you. I won't be sending you any information about the scan because obviously with it being, you know, last minute and all. So in a moment, if you can head over to the scanning department and go to reception, they will book you in and they will tell you everything you need to know and go through step by step with you. All right. Okay. You're very welcome. And then I will speak to you in a week and then I'll see you in 2. All right. Remember, book your appointment at the dentist ASAP. All right. I will send you over a written report and you can take that with you. And then we can, you know, go from there. But definitely look at something, you know, to help you with the nightmares and things like that. That will really help. All right, my lovely. You're very welcome. You take care now. Bye-bye.